Wildfires have always been a natural part of the environment, but in recent years, they've been burning bigger, hotter, and more often than ever before. Even if you don't live near a wildfire, we are still affected by its smoke, which can travel thousands of miles, polluting the air we breathe and causing potential serious chronic health problems. In this video, we'll explore what's driving the increasing number of wildfires, how wildfire smoke affects our health, especially fine particulate pollution, what we can do to prevent and prepare for wildfires, and long-term solutions to mitigate health consequences. Let's start with the basics. Wildfires aren't new. They've been shaping forests and landscapes for thousands of years. Some ecosystems, such as certain pine forests, even require fire to release their seeds in order to grow. But today's wildfires are different. They're burning more land, spreading faster, and lasting longer than ever before. The question is, why? Climate change is creating a fire-ready environment. Hotter temperatures. As the planet warms due to increasing carbon emissions, heat waves dry out vegetation, turning trees, grass, and brush into perfect fuel for fires. Many regions are experiencing longer droughts, making it easier for wildfires to start and spread, while at the same time diminishing our abilities to combat them. Increasingly stronger winds can carry embers miles away, igniting new fires in an instant. On top of this, there have been more human-caused fires. While natural causes like lightning do start some wildfires, the vast majority, about 85%, originate from people. This includes sparks from internal combustion vehicles or machinery, unattended campfires, cigarettes tossed on dry grass, and power lines sparking in high winds. Poor forest management. For over a century, wildfires were aggressively suppressed, meaning small, natural fires weren't allowed to burn, but this led to overgrown forests packed with too much fuel. Now, when a fire does start, it has way more material to burn, leading to massive, uncontrollable blazes. Wildfire smoke is filled with tiny, toxic particles called PM 2.5, short for particulate matter that is 2.5 micrometers or smaller. To put that in perspective, PM 2.5 particles are 30 times smaller than the width of a human hair. So tiny that they even bypass our nose and throat, traveling deep into our lungs, all the way into our bloodstream. Breathing in PM 2.5 can cause immediate health effects like coughing, difficulty breathing, irritated eyes, and a sore throat. But it doesn't stop there. There are serious long-term problems too. Heart disease, lung disease, strokes, and even premature death. These risks are even higher for vulnerable groups such as children, the elderly, pregnant women, and people with respiratory conditions such as asthma or chronic cardiovascular disease. And here's the tricky part. Wildfire smoke doesn't stay put. It can travel thousands of miles, meaning that even if a fire is burning in California, people in New York or Canada can still be breathing in the fine particulates generated by those flames. While we can't stop all wildfires, we can take steps to prevent them and protect ourselves from their effects. Preventing wildfires before they start is crucial. One effective method is prescribed burns, where experts set small, controlled fires to clear out excess vegetation before a big wildfire can ignite. Better forest management also plays a key role. Thinning out overgrown forests and removing dead trees can significantly reduce fire intensity. Public awareness is equally important. Avoiding activities that can spark wildfires, such as burning debris on windy days or leaving campfires unattended. Protecting yourself from wildfire smoke is crucial. When it is smoky outside, wear an N95 mask. Cloth masks don't filter out fine particulate matter. When air quality is poor, stay indoors, close windows, and use air purifiers. Check air quality alerts. Apps like airnow.gov help track smoke levels, and if possible, employ MERV air filters in home and improve weather sealing. Addressing climate change, the big picture. Long-term solutions require reducing greenhouse gas emissions to slow down climate change. Here's how we can help. Switch to clean, renewable energy, such as wind and solar, which reduce our reliance on fossil fuels. Use sustainable transportation, walk, bike, or take public transit when possible. Plant trees and protect forests. Healthy forests and green urban landscapes absorb carbon and reduce fire risks. Support policies that address climate change. Both small local and large global actions both matter. Wildfires aren't just a problem for forests. They impact our health, our air, and our future. But by understanding the causes, taking action, and supporting long-term solutions, we can reduce the impact that wildfires cause and create a safer, healthier world for future generations.